The next screen is the hurdle step. The hurdle step is designed to challenge the body's proper stride mechanics during a stepping motion. The test requires lower extremity disassociation, which places the body in a challenging position. The movement requires proper coordination and stability between the hips and torso during the stepping motion, as well as adequate single leg stance stability. The purpose of the hurdle step is to assess bilateral functional mobility and stability of the hips, knees, and ankles. In describing the hurdle step, the athlete places the feet together and aligns the toes directly beneath or touching the hurdle. The hurdle is adjusted to the height of the athlete's tibial tuberosity, and the dowel is positioned across the athlete's shoulders below the neck. The athlete slowly steps over the hurdle and touches the heel to the floor while keeping the stance leg in an extended position. Weight should remain on the stance leg. The athlete then slowly returns to the starting position. The athlete is allowed up to 3 chances to perform the test bilaterally. Tips for testing include scoring the side that is stepping over the hurdle, making sure that the individual maintains a stable torso, making sure that the toes keep in contact with the hurdle before and after each repetition, maintaining proper alignment with the string and tibial tuberosity, and when in doubt, score low. Do not try to interpret the score while testing. Criteria for obtaining a 3 are as follows. Hips, knees, and ankles remain aligned in the sagittal plane. Minimal to no movement is noted in the lumbar spine. And dowel and hurdle remain parallel. Now, let's review the hurdle step. Now, this is one of the hardest screens to actually score. We're actually looking at several different mechanical differences here. The first thing is actually to identify which leg is going to be the stance leg. That's the leg that we're concerned most of all from a stability standpoint, and the other leg is going to indicate the need for mobility. So as Steve steps over, the left leg is actually going to be indicated as a stance leg, in which we're looking at the stability of the leg all the way up to his ability to maintain a good, stable torso. The leg which is moving, or the right leg, would indicate the necessary amount of mobility in order to clear the hurdle. We're also looking close to make sure that Steve does not contact the hurdle. However, there may be a slight brushing of the leg once it actually crosses over just with the back or the posterior part of the knee. We're looking at any lateral deviation from side to side of Steve's lumbar spine, as well as any lumbar flexion that may take place if Steve has difficulty in actually clearing the hurdle. In addition, the dowel gives us a very good perspective relative to its position in coordination with the hurdle. Are the two parallel? If they're not, and he actually indicates that he slings to one side or the other, then that would be representative of lateral flexion. Therefore, we'd have to score it appropriately. Now, the original one that you saw Steve do, he actually would be scored a 3 based on his ability to actually clear with good mobility and stability. What Steve has done for you here over the last few repetitions has actually created a few compensations to indicate altered scoring. Very good. Okay, that concludes the review of the hurdle step.